Now we are going to talk about in vitro fertilization treatment or IVF. In vitro fertilization or IVF treatment is one of the commonest treatment modality that has been used for a decade or more than a decade for the treatment of infertile couples. IVF or in vitro fertilization, that means fertilization happens outside the human body. Naturally, in a human body, the fertilization happens inside the fallopian tube. Fallopian tube is a tubular structure on the side of the uterus that is connecting the uterus and the ovary. The eggs coming out from the ovary meets the sperm in the fallopian tube and gets fertilized. That's what is happening normally. But in an IVF treatment, the eggs will be taken from the ovary to the outside of the human body, and these eggs will be injected with human sperms. The resulting embryos will be transferred later on to the uterus. So, in what all situations we may need IVF treatment? IVF treatment is recommended for those females who have permanent blockade of the fallopian tubes. The fallopian tubes might have been blocked either by disease or they might have lost it by surgery. In males, this IVF treatment may be recommended in case when all other treatments fail, number one. Number two, when there is decreased number of spermatozoa in the semen sample which is inadequate for normal fertilization, or in case of azoospermia. Azoospermia is a situation where there are no sperms in the semen sample. So, in such situation, we have to retrieve the sperms from the testes, and that sperms have to be utilized for injecting into the oocyte. Oocyte means egg. The injection of a sperm into an oocyte is called ICSI, that is intracytoplasmic sperm injection. The procedure of retrieving sperms from the testes is known as TISA. So, these two procedures together they call it as TISA ICSI or PISA ICSI. In such situations, techniques called micro TISA may be applied in situations where we cannot get sperms on regular TISA procedure. So, what are the steps in an IVF treatment? The first step of an IVF treatment is to assess how much the treatment will be successful. This can be assessed by various blood tests, scanning, blood flow assessment, etc. in the patients. Then this particular patient or the couple will be selected for IVF treatment. To start with, the female will be given few tablets for 2 to 3 weeks. Then after the onset of menstrual bleeding, the injections to produce multiple oocytes or eggs will be started. These injections will be continued for a period of 10 to 12 days. When the number of follicles and the eggs reach a particular number, these eggs will be retrieved from the ovary, and to these eggs the sperms will be injected and the embryos will be developed. This injected oocyte or egg will be kept in the incubator, and it will be observed after 24 hours, then again after 48 hours, then again after 72 hours or 5 days. So, we will be getting the embryos on second day, third day or fifth day. The fifth day embryo is known as blastocyst. So, these embryos may be transferred either on day 2 or day 3 or the blastocyst stage. If we transfer the embryo on a blastocyst stage, we need to transfer only one blastocyst. There are a lot of newer developments or latest additions to these treatment modalities. One of them is called IMSI or intracytoplasmic morphologically selected sperm injection. In this situation, the sperm will be selected under 8000 times magnification. Another advancement is time-lapse embryo monitoring or embryoscope, whereby we can observe the development of embryo or the injected oocyte every second by second, and we can see the speed with which the embryo is developing. So, it helps the embryologist to select the best possible embryo to get implanted, and this can be transferred later on. Another technology called laser assisted hatching, where we can hatch or thin out the external membrane of the embryo so that it can get hatched inside the uterus easily. Another few techniques called MAC or magnetic assisted cell sorting or MFS. These techniques will help us to to select the best possible sperm to be injected into the egg. Latest addition is pre-implantation genetic screening, where we can screen the cells of the embryo for all the chromosomal patterns, and we can discover the best possible embryo without any genetic aberrations, so that we can even transfer a single embryo. That is called single embryo transfer. Then what is the possibility to have pregnancy during this treatment? The IVF ICSI treatment, with the latest advancements, we can offer pregnancy rates up to 40 to 60%. But mind it, it depends all on about the age of the female partner. The age of the female partner, if it goes up, the chances will go down. And also, the chance of pregnancy depends on the grade of the embryo, the quality of the embryo which we transfer. If the patient gets the grade 1 embryos in good quantities, good numbers, they have a fairly good chance of pregnancy. And there are two types of embryo transfer. Embryos can be transferred in the same menstrual cycle, the cycle during which we retrieve the oocyte, or it can be transferred at a later date after freezing these embryos. So this frozen embryo transfer, that gives a better pregnancy rate in the current scenario.